Now, you may guess that technically all of us are at risk of lead exposure in one way or another. It's found in the soil, air, water, and even our food. Well, the good news is that the levels usually found in them are either extremely low or close to none. And there are ways to protect yourself if you know you could be exposed. Knowing common environments for lead exposure will help keep you prepared. In industry, workers most at risk are the ones involved in the production, use, maintenance, recycling, and disposal of lead products. Basically, anyone that works with lead in any way. Now, those at the highest risk used to be lead smelter workers and miners. This was ground zero, where lead was first extracted from its ore. Now, all primary lead smelters and mines in the U.S. are no longer operational. Today, the construction and manufacturing industries have the highest risk of lead exposure. Now, why are construction and manufacturing such high-risk industries? If you work in the construction industry, remodeling, renovating, and demolishing structures is super common. If you work on a structure built before 1978, you've probably come into contact with lead-based paint. In addition, you might have been exposed to lead piping or plumbing fixtures as well. And finally, you'll probably also have to work with lead alloys or other lead metals. Renovations and demolitions could involve sanding, heating, scraping, and sweeping up messes. These can create dust that may contain small particles of lead. Now, without proper protection protocols, the lead dust could be inhaled or ingested. Manufacturing is categorized as a part of general industry. It's also an industry with a high risk of lead exposure. What manufactured products use lead? The manufacturing of storage batteries, radiators, solder for joints or plumbing, bullets, pottery, wire, and stained glass windows may require lead. If you work in a facility that produces any of these products, listed or other that require lead, you could be at risk of exposure. Okay, so now we know all of us could be exposed to lead, some more than others. Let's talk about how lead harms the body. When working, it can be inhaled. You can breathe in lead-containing dust or fumes. This can even happen in outside work if your hobby involves lead. You could even bring dust home on your clothing, and others could inhale it. And once it's inhaled, it passes through the lungs into the blood. Now, once in the blood, different organ systems can be harmed. Lead damages the nervous, cardiovascular, and blood, reproductive, and urinary system. Damage to these body systems can lead to neurological or gastrointestinal issues, anemia, and even kidney disease. Even minimal lead exposure to a pregnant woman can cause damage to a fetus. It can cause stillbirths, birth defects, intellectual disability, or behavioral issues. Young children, especially if they are 6 years old or younger, can develop cognitive impairments. Now, for everyone, even just a few days of lead exposure can cause acute encephalopathy. And this is a brain condition that can cause seizures, comas, and even cardiac arrest. Long-term exposure can lead to even more serious problems. Lead can also be ingested. Now, this occurs when a contaminated surface is touched and it gets on your hands. If you then eat, drink, or smoke, it may find its way into your body. This usually happens with young children or workers who do not follow the proper personal protective equipment precautions. For kids, their hands get contaminated, then they might place their hands in their mouth. They are also way more likely to put an object into their mouth which may have lead-based paint. For workers, simply eating on the job without protection from lead exposure has the same result. Now, regardless of how lead enters the body, it adversely affects it in the same ways. Some common symptoms of overexposure to lead are loss of appetite, excessive tiredness, headache, colic, which is severe pain in the abdomen, a metallic taste in your mouth, muscle and joint pain or numbness, insomnia, nausea, hyperactivity, fine tremors, dizziness, anxiety, or pallor, which is pale, unhealthy-looking skin. If you've been exposed to lead and have experienced any of these symptoms, you should seek medical advice immediately.